So let's talk about an arm lift or brachioplasty. What is a brachioplasty? Brachioplasty is a procedure that focuses on the correction of your arms bilaterally. This procedure oftentimes only focuses on the arm, which is include the proximal, middle, and distal aspect of the arm, and sometimes it includes your lateral chest wall correction. Who is a good candidate for a brachioplasty? Patient in a normal ideal weight with a BMI close to normal, which is oftentimes less than 30, are good candidate for brachioplasty. Also, patients that oftentimes do not have a lot of excess fat and mostly have excess skin are a great candidate for this procedure. If you have a lot of excess fat along the excess skin, sometimes we have to divide the procedure in 2 stages to give you the best outcome possible. What is the duration of a brachioplasty? A brachioplasty takes an average between 2.5 to 4.5 hour surgery, depending on the complexity of the procedure and the type of procedure that we choose. What kind of anesthesia do you need for brachioplasty? Anesthesia for brachioplasty could be a local sedation for a mini brachioplasty, and it could be a GA or general anesthetic for a complete brachioplasty. What are the types of brachioplasty and why do we choose different types for different patients? Brachioplasty comes in different types. There is starting from a mini brachioplasty to a normal brachioplasty to a normal brachioplasty with a horizontal incision to an extended brachioplasty. Now, what is a mini brachioplasty and who is a good candidate for mini brachioplasty? Mini brachioplasty is a combination of liposuction with a avec excision that sits into your axillary fold, and it only corrects the proximal aspect of your arm. What it means is that if you have any excess distally or in the middle aspect of the arm, the mini brachioplasty is not a good option for you. It can still improve you, but it will not give you a tight arm. Who is a good candidate for normal brachioplasty? Normal brachioplasty is an incision that starts from the elbow. It oftentimes sits between the brachial groove and the posterior aspect of the arm, so somewhere in this vicinity, and it corrects the problem with the skin and fat of your proximal, middle, and distal upper arm. It does not include your forearm and it does not change the lateral chest. Good candidate for this procedure are the patients that only have a small amount of excess fat and quite amount of excess skin of the upper arm. Extended brachioplasty is a brachioplasty that starts from your arm, from your elbow, and it goes into your axillary fold and it descends on the lateral aspect of the chest to correct excess skin or fat in the lateral chest wall. Who is a good candidate for this procedure? The good candidate for an extended brachioplasty is a patient with a massive weight loss who's got a lot of excess skin, including the arm and the lateral chest. It corrects the arm excess and also lateral chest excess, and it is an excellent powerful tool that sometimes you can combine with your breast lift. What is the recovery time for a brachioplasty? The recovery time for a brachioplasty is 2 weeks if you're doing an office work, 10 to 14 days for working from home, 6 weeks for any excessive exercise or if you're working in a physical type of work. What do you need to do in order to prepare yourself for a brachioplasty? You need to make sure you are well hydrated, you eat well, your hemoglobin status is good, your BMI is close to normal, and you've completed your weight loss journey and you have a stable weight. A stable weight, we would like you to maintain it for at least 6 months before the procedure if possible, because like any other procedure in plastic surgery, fluctuation of weight is your worst enemy. Brachioplasty and drains. Do you need drains for a brachioplasty? Drains are needed in a normal brachioplasty or extended brachioplasty. Oftentimes, the drain stays with you between 3 to 5 days in order to make sure you don't have any major complications, there's major bleed or serum formation immediately post-op. For a mini brachioplasty, oftentimes we do not place any drains. How long do you need to wear your binder? Binder post brachioplasty is 6 weeks 24/7, and after that 6 weeks for half a day. Oftentimes, we started with a binder or a wrapping process that's a bit larger. Once you've lost the majority of swelling, which is around 6 weeks, we change it to a stage 2 binder. The benefits of brachioplasty is correction of your upper arm and arm for excess skin and fat, with replacement of the excess skin and fat with scar.